Now, welcome friends. I'm your host, Dr. Shadab Jafri. It's been quite some time we haven't done any videos. And now today I'll be going to deal another very important topic, very important NICT topic, the flow volume loop concept. Now, this has been often asked in the NICT as a multiple choice questions where they will give three or four loop flow volume curves and then they will give four options and you have to match all the four options sequence wise. Now this can be asked in the NEET PG also, and this concept is very important for you to understand, and it has been given in the various textbooks and on the Google also you can search. But when I was reading this topic, I felt that something is missing in everywhere. Either in the some textbooks it is not given, so uh, student cannot understand properly what it's depicting. So today our main stress will be on to know to read those flow volume loops, uh, which will be helpful for your examination also and in your day-to-day practice also. If you see the PFT or the pulmonary function test report, so it is going to be very important. It's a very practical point of view. It's going to be very advantageous for you in all your future endeavors. Now see this figure carefully. This is the concept of the flow volume loop. What are the flow volume loops, and where do you get these flow volume loops? Now, in the pulmonary function test, when you are doing the spirometry, when you see a long report, and at the back side of the report there is one loop given, and these are those loops which we have to understand. If you don't know to how to read the PFT report, then you can basically see this flow volume loop, and you can understand whether the patient is not having normal or abnormal flow volume loop and whether and what type of disease he is having. You can get a very instantaneous idea by seeing this flow volume loop. And this has been often asked in the INICT examination. And this is a very interesting topic which which you should understand. Now see carefully in this figure. You can see this. You can get this figure if you search on the internet. But what is not given on the internet, I will try to explain that. You see carefully that this is there's one x-axis and the y-axis. On the y-axis, the flow volume, the flow is given, which is in liters per second, and on the x-axis, the volume of the lung is given. Now, carefully you see what is happening. Now, when you put the mouthpiece of the spirometer and you start inspirating, you start your inspiration. Now, when you start your inspiration, see carefully. From the right hand side, you see carefully. So, what is happening? As you inspire gradually from the zero to the normal one is given in the normal loop is given in the black, you see. Now, when you are inspiring, it is going from the zero up to the six. Zero up to the six is that here the zero is the residual volume, and not zero is the residual volume. Here something greater than one is given for residual volume, and it is going up to six. So that is the total lung capacity, which is on the full inspiration. Now, after that, when you are having the full inspiration, you have inspired forcefully, the total lung capacity is achieved. Then you forcefully exhale. Now, when you exhale forcefully, then you see that the volume is starting to decrease. And the peak, when the peak reaches, that is the peak expiratory flow rate. And then gently it comes down until you have reached again the residual volume. So this whole flow volume loop is formed. Now, here color-wise depiction is given in this very interesting figure. You can see that what is happening in the obstructive lung disease, what is happening in the restrictive lung disease, what is happening in the fixed upper airway obstruction. I will gradually go one by one and try to tell you actually what happens so that you can easily, there's no need to memorize or mug up the figures. You can easily, whenever the options come, you can easily go through the question and it will be a cake for you. Now you carefully see in this figure that the normal loop is given in the black. Now the abnormal which we mainly get are of two types, the obstructive lung disease and the restrictive lung disease. Now, obstructive, what are the obstructive lung diseases? The obstructive lung diseases are the bronchial asthma, which is the most common acute emphysema, acute bronchial asthma, or the COPD and emphysema, chronic bronchitis. So these are the other common obstructive lung diseases. And you see that the green figure is given in the for the obstructive lung disease. What is happening? You carefully see. Now you see that the residual volume is increasing because the patient is not able to exhale properly, and hyperinflation is taking place, and the total lung capacity is increasing as the hyperinflation is taking place. It is going above 6 from 0. It is going more towards the left side. So the total lung capacity is increasing, and the person is not able to exhale properly. Why? Because there is a thinning of the airways due to secretions or bronchoconstriction. So he is not able to exhale properly, and his forced expiratory volume FEV1 is reduced, and his forced vital capacity, that is not reduced to that much extent, but it is reduced. He can achieve in some amount of time. So that is the basic thing. Now you see in the restrictive lung disease what is happening. The figure which is given in blue. Now in the restrictive lung disease, like the pulmonary fibrosis and all those the interstitial lung disease. Now what is happening? There is restriction. So here basically you see that the curve is shifted towards the right. Now right for restrictive, and the curve is shifted towards the right. And what is happening? The residual volume is decreasing. The residual volume is decreasing, and total lung capacity is also decreasing. You see in this figure, which I have marked in the red. Now you carefully see, I have modified this figure. Now what you can see, what extra can you see in this figure? Now you can see that the peak expiratory flow rate has decreased in the obstructive lung disease, and it has also somewhat decreased in the restrictive lung disease. Now the FEV1, which is the forced expiratory volume in the first second, that is mainly that is reduced in the obstructive lung disease, and that is normal in restrictive lung disease. In restrictive lung disease, all the volumes, whether it is the total lung volume, residual volume, FRC, all the volumes are decreased. That is very important for you to understand. You can see here also that the residual volume is decreasing in the restrictive lung disease. And in the restrictive lung disease, one thing is also very important, that the forced vital capacity, that is decreasing. The FEV1 is not decreasing, and so you will see the ratio that FEV1 by FVC can be sometimes increased also in restrictive lung disease, which has often been asked in various entrance examination. And it is given in the MCQs that FEV1 by FVC is increased. So the answer will be restrictive lung disease in that case. Now, it's not important that you remember all those flow charts, a very long flow charts, but these are the salient points which you should remember, and then you can solve the question which is given in your question paper. Now coming to the main part of our this video, the different type of flow volume loops which have been asked often in the examination. So we have dealt the obstructive and the restrictive. Here we'll go in the brief and see in this figure that you can see that in the obstructive there's a kink in the expiratory part after the peak expiratory flow rate is achieved, and the severe obstruction, the expiratory part is very limited, it is shortened very much, and so you can see that the forced expiratory volume, that is reduced, although the forced vital capacity is achieved. Now you come to the figure, the third line figure. You can see the restriction, what is happening in the restriction in the restrictive lung disease. Now you see in the figure of the third line, what is happening in the restrictive lung disease, as I have told you that the whole flow volume loop is shifted to the right side. Now two types of restriction can be seen, either the intrathoracic, that is pulmonary fibrosis, whether it can be any restrictive lung disease, pneumoconiosis, sarcoidosis, etc. So the first thing you will see that the curve is shifted towards the right. and every volume is shortened. So it is a small flow volume loop. Normal one you have seen, it is a big loop. And similarly in the kyphoscoliosis part, which is extrathoracic obstruction, in that case also you can see that thing. That can be obesity also or asthenia gravis. So these are the restrictive lung diseases. So now in this below figure you can see that there is something even like bronchodilation pre and post. That is very important to which here it is will deal somewhere else. That if you they are in the bronchial asthma and the COPD, the bronchial asthma responds to the bronchodilation, whereas the COPD does not respond to the bronchodilation, and that thing will be reduced in the if there is a patient is having bronchial asthma, but in COPD that's not the case. Now come back to those middle figure which we have not dealt so far, and those are very interesting, and those will be given the option. Those are the clinchers. Now you see that first you have to see there is a fixed airway obstruction, means both the intrathoracic and extrathoracic obstruction are present. Now you see these interesting figures. First you see the figure in the purple on the right hand side. Now you see the fixed if there is a fixed intra or extrathoracic upper airway obstruction. Now how the flow volume loop will be seen. Now you see that there is a flattening, there is a flat line on the upper part of the curve also, and as well as the lower part of the curve also. That means the fixed. Both the curves, the expiratory and the inspiratory curves they are showing flattening, and that is the clincher here because the obstruction is fixed. So when the obstruction is fixed, so the inspiration and the expiration both will be affected. Now you see here the curve on the right hand, the curve on the left hand side. Now it is showing the variable intrathoracic upper airway obstruction. Now what is happening in the intrathoracic upper airway obstruction? Now you see that the expiratory part of the curve that is showing the flattening, and the flattening you have to see. And the middle figure, which is shown in the purple, there is variable extrathoracic upper airway obstruction. Now the causes of these variable obstruction are not asked, but I will show you in the next figure what are the causes. Now the clincher here is that you have to see the flattening. If both the expiratory and the inspiratory curves are flat, then that is the fixed obstruction, which will be given in your MCQ. If the upper part of the expiratory curve is flat, then that is the that will be if only the one curve is flat, and that will be the variable. Now you have to decide between the two, whether it is the extrathoracic or intrathoracic. Now if the intrathoracic obstruction is there, variable intrathoracic, then expiratory part of the curve will be flat. Now if the extrathoracic obstruction is there, then the inspiratory part of the curve will be flat. So just like that you can remember, and this is going to be only asked in the examinations. And in the next figure I'm going to show you all the causes, what are the causes, so you can have a look on that. If those are asked in examination, you can answer those. Now you can pause your video and you can see what are the various causes of different types of obstruction, be it fixed obstruction or variable intrathoracic or extrathoracic obstruction. These are not asked, but you can have a look, and if sometimes they can be asked, then you can answer them easily. Now before we close this topic, we can summarize the basic things. So obstructive and restrictive, I think you can easily recognize, but the confusion arises between these fixed and the variable intrathoracic and the variable extrathoracic. Now, if the expiratory part of the curve is flat only, then that is a variable intrathoracic obstruction. If the inspiratory part of the curve is flat, then it is the variable extrathoracic obstruction. Now, if the both parts of the curve are flat, that is the fixed obstruction. Now, I hope you enjoyed this video, and please do like and subscribe our channel, and thank you.